All right, we're going to talk about some of the most prescribed drugs on the entire planet, ACE inhibitors and ARBs. For millions, these are absolute lifesavers. But, and this is a big but, there's a crucial catch. It's all about this really delicate balance that, if you don't manage it just right, can turn a life-saving tool into a potential risk. And walking that tightrope, it takes a real partnership between you and your doctor.
So let's just start with the big question. Does this explainer even apply to you? Given just how incredibly common these medications are, there's a really good chance the answer is yes, for you or, maybe someone you care about.
If you recognize any of these names, lisinopril, losartan, ramipril, valsartan, then yeah, you are definitely in the right place. And believe me, these are just a few of the most common ones out there.
So why are they everywhere? Well, because they are absolute workhorses in medicine. They're a go-to treatment for high blood pressure, a total cornerstone for managing heart failure and chronic kidney disease, and they are absolutely critical for protecting the heart after a heart attack.
And this right here, this gets to the very heart of the problem. This quote, it points out this huge paradox. The fear of side effects often means these drugs aren't given to the very patients who stand to benefit the most. It all comes back to understanding that balance.
Okay, so to get how these drugs work, first we have to understand the system in the body they're designed to mess with. It's called the renin-angiotensin-aldosterone system. We just call it RAS for short. And you can think of it as your body's own internal thermostat for blood pressure.
Let's just walk through this real quick. It all kicks off in the kidneys. When they sense your blood pressure is low, they release a substance called renin. Think of renin as the starting gun in a race. It sets off this chain reaction that leads to the creation of a super powerful molecule called angiotensin II. Now, angiotensin II, that's the main character in this story. It does two big things. It literally squeezes your blood vessels tighter, and it tells your body to hang on to salt. Both of those things, they drive your blood pressure way up. It's a brilliant system for when your body needs it.
So if that's the body's natural machine for jacking up blood pressure, then these medications are basically designed to throw a perfectly placed wrench right into the gears to slow the whole thing down. And they do it in two pretty clever ways.
So you can see here we've got two different strategies to get to the same finish line. ACE inhibitors, like lisinopril, they block the enzyme that makes that powerful angiotensin II molecule in the first place. Simple, right? If it's never made, it can't cause any trouble. ARBs, on the other hand, take a different approach. They let the body make angiotensin II, but they block the docks, the receptors, where it's supposed to land and do its job. It's like putting a cover over a keyhole. And a big reason we have this second option, that annoying persistent dry cough that something like 20% of people get on ACE inhibitors, ARBs were developed to be a cough-free alternative. And when you intervene like this, the results are just profound. Your blood vessels chill out, which brings your overall blood pressure down. But here's the really critical part. This also lowers the physical pressure inside the tiny, delicate filters of our kidneys. This is exactly why these drugs are so protective for people with kidney disease or diabetes. They're literally acting like a shield for these vital organs, protecting them from long-term damage. But remember that delicate balance, that tightrope walk we talked about? Well, blocking such a powerful system can sometimes tip the scales a little too far in the other direction. And there are two main side effects that we absolutely have to watch for. Okay, problem number one is something called hyperkalemia. It sounds complicated, but it's really just the medical term for having too much potassium in your blood.
Now, the really tricky part here is that the people who are at the highest risk for developing high potassium are often the very same people who get the most benefit from these drugs. People with kidney disease, heart failure, and diabetes. This is why monitoring with blood tests isn't just a good idea, it is an absolute necessity.
All right, the second issue can be super confusing for people. After starting one of these drugs, you might get a blood test back and see that your creatinine level, which is a marker for kidney function, has actually gone up. I mean, that sounds bad, right?
Well, here's where it gets weird. The medical world has this fascinating, totally counterintuitive name for this. They call it pre-renal success. Now, what on earth could possibly be successful about a number that makes it look like your kidneys are working worse?
So here's the key to understanding this. Imagine a garden hose that's been running at full blast for years, just putting a ton of strain on the nozzle. When you finally turn that pressure down, the flow might decrease just a little bit at first, but what you're really doing is saving the nozzle from getting destroyed. That is exactly what's happening in the kidney. The drug lowers that damaging high pressure inside the kidney's filters. So that little bump in creatinine is actually a sign that the pressure has been reduced. It's the signal that the medicine is working and protecting your kidneys for the long haul.
But, and this is a huge, huge but, there is a line. A small rise is good. It's expected. A rise of 30% or more from where you started, that is a red flag. That's the signal that the scales have tipped too far, and it's time to adjust the plan to make sure we don't cause any harm.
So this brings us right back to the tightrope. How do we get all the incredible benefits from these drugs while safely managing the risks? Well, it all comes down to teamwork.
But this is where we run into a really big problem, a major gap in care. One study found that fewer than 10%, let me say that again, fewer than 10% of patients actually get the recommended follow-up blood tests after starting these drugs. That number is just staggering, and frankly, it's dangerous. It's the #1 reason why you being aware and being a part of your own care is so critical.
The good news is there's a very clear step-by-step plan for when those levels do go up. First, we look for other culprits, like being dehydrated or taking another medication. Then we can try simple things, like dietary changes. If that's not enough, the dose gets reduced, and we recheck the blood work. See, it's a very methodical process, not a reason to panic.
So, what can you do? How can you be an active partner here? First, ask your doctor about your diet. Second, make absolutely sure they know about every single thing you take. That includes over-the-counter pain relievers. Third, ask about sick day rules. This is just knowing when it's smart to temporarily stop the pill, like if you get a stomach bug and get dehydrated. It's a way to protect your kidneys. And finally, the most important one, always get those follow-up lab tests done on time.
So what's the big takeaway from all this? Simple. We are dealing with an incredibly powerful tool for protecting our hearts and our kidneys. And just like any powerful tool, it demands our respect and very careful handling.
And let's be crystal clear about the bottom line here. For the vast majority of patients, the life-saving benefits of these drugs just overwhelmingly outweigh the risks. The key word in that whole sentence is managed. It's only true if they're monitored and managed correctly. This isn't just about a doctor writing a prescription. It has to be a partnership.
And you know, the future on this is looking even better. There are new medications coming out that are specifically designed to help the body get rid of extra potassium. They actually work in your gut to bind it up, which could mean that even the highest risk patients might be able to safely stay on their ACE inhibitor or ARB. And that leaves us with one final exciting question to think about. As medicine keeps advancing, could we actually see a day when this whole delicate balancing act just isn't needed anymore? A day when we can get all of the incredible benefits of these drugs with none of the risks? Well, the research is definitely pushing hard in that direction.